Canary in my coal mine, what your pet can teach you about chronic disease and mortality. Our guest is a Cornell-trained veterinarian with a special interest in integrative veterinary medicine and veterinary acupuncture. It is my great pleasure to have on Health Media Live, Dr. Nina Malik. Welcome to the program.
Yeah, I want to start off by saying, when you first told me that you wanted to talk about what our pets can teach us about overall human health, I just thought it was a great topic for a non-veterinarian to come up with, because in my practice, I see how bonded human caretakers and owners are with their pets. And for this reason, I feel that very often the dogs and cats are kind of holding up a mirror to that individual's lifestyle, and also to the general trends in human medicine and human health and human lifestyle, because of the very close bond between the human and the pet. And one of the simplest ways and easiest ways to start this is with a discussion about pet obesity. We have an epidemic of pet obesity in the United States. And every year there is a National Pet Obesity Awareness Day study that's done, where in 2009 they actually surveyed over 41 vet clinics and over 600 animals, and found that over 1/3 of the dogs and cats that they looked at were overweight, and a good proportion of them were obese, meaning that they were greater than 30% above what their normal body weight should have been. So in real numbers, I want to give you some real numbers because that kind of hits home. 35.9 million dogs are estimated to be overweight in the United States, and 54.3 million cats are estimated to be overweight. And we all know in human medicine that there's a great cost to obesity. I just heard on the news this morning, actually, while I was getting breakfast, that they've actually put a dollar amount on the cost of human obesity. For women, that's estimated to be $8,000 a year. And for men, it's estimated to be $5,000. But basically, there's an actual dollar amount that they can put on the cost of obesity in humans.
Well, I don't know if you can actually put a dollar amount. You can estimate in some ways a dollar amount, but ultimately, the costs that are associated with it long term cannot be predicted because it's multi-generational. Mm-hmm. You destroy your life because you are exposed to a lot of misinformation, and then that misinformation gets passed down to your children and their children and on and on. And the obesity epidemic in the human arena is growing exponentially. I mean, we're at a point now where most of the human beings in our country are overweight and a third are obese. So our animals are reflecting that in many different ways. The only difference is our animals don't take themselves to the fast food restaurants that we make the choice to come. So they're totally dependent on what we feed them. So I think that some of the contextual habits that we've developed and the way we feed our pets and the way we feed ourselves are creating a lot of the underlying problems for both us and them.
That's true, and it's so multifaceted. So the first place is in just perception. In this study that they looked at, they asked people their perception of their pet. And they asked them, do you think that your pet is in normal body condition or it's overweight? And most of the time, people with very obese and overweight pets could not identify that their animal was actually in an unhealthy body weight. So just like in humans, there are broadcasts of like what the fattest cities in America, and its perception really plays into what your standard of normal is. And that's happening with pet owners and their dogs and cats. And interestingly, from my point of view, the owners that had the hardest time telling that their pets were overweight were large breed dog owners. Those of Labrador retrievers and golden retrievers, which happen to be about almost half of those pets, are estimated to be overweight in the United States. So we have a real perception problem.
So your interest is integrative health and integrative approach to health and healing, as well as acupuncture for animals. I mean, that's a little bit exotic, unusual, especially here on Long Island. I don't know, are there other animal acupuncturists here?
I'm one of a few. There aren't too many people who make this their full-time practice like I have. But from my perspective, traditional Chinese acupuncturists very often came from a very long lineage, and they learned from their grandfathers and their fathers. And so in order to be a master acupuncturist, you really need to see a lot of cases and do it all the time. And so that was my goal when I went into this, is to become a master acupuncturist for dogs and cats, believe it or not.
All right. So, but why integrative? What is integrative as opposed to, I know what's integrative as opposed, but what is integrative as opposed to allopathic approaches to healing dogs And why did you decide to look at it from that perspective as opposed to the way the rest of the vets are treating our pets?
Yes. Well, okay, my definition of integrative is that I combine the Western with only alternative practices that have a very strong body of scientific evidence behind them, that they're safe and that they work, or they've got centuries of history behind them, like acupuncture. So I really cherry pick the alternative practices that I bring into my integrative practice. But the reason why I started with integrative practice is I had been trained at Cornell. I did an internship at Penn, and I went on to become an emergency doctor. And I was seeing pets on emergency coming in with chronic illnesses like arthritis. And the owner would come in, the dog wouldn't be able to stand. They'd look at me and say, "Doc, you're the emergency vet. You have good training. Give me the magic pill that my regular vet had been hiding from me for the past 3 years." And I'd look at them and say, "Man, I wish I could, but I have nothing for you." What they did was what we have. And I started scratching my head, and we were putting these dogs down, that were otherwise healthy with chronic inflammatory diseases, a lot of them, arthritis, inflammatory bowel disease, various diseases like that. And I just thought to myself, there's got to be a better way. And I started digging. And that's when I came across a bunch of acupuncture schools, and I decided to go.
Well, I was just thinking, lucky I'm not a dog, because if I was, you'd have to put me down about 5 years ago, because I had a lot of the chronic inflammation, the arthritis, and everything else. And there was the wellness-oriented physicians that we work with, Dr. Lynch specifically, who taught me and helped me to regain my health and well-being. So I think from that perspective, the information that we share with people can absolutely transform their health if they would just adhere to it. And the same thing goes for our pets. So what are the approaches that you take with these animals that are dealing with arthritis, with digestive problems, with cancer, with all of these ailments that we see in our population? How do you deal with it? I mean, you don't have the magic pill, so what do you do?
Well, that's a complicated question, and it really depends on the patient. But let's take arthritis, okay, as a simple example. So first of all, if a pet has arthritis, the topic that we started with, obesity, that's going to cripple the animal. We know medically that being overweight is going to exacerbate or even cause arthritis in people, in pets. So the first thing I'll do with a case like that is I'll have it lose weight. So we have a whole topic that we need to get into, which is how do we feed our pets. And I will often change the diet, change the recommendation of how the person's feeding the diet, and incorporate then, and back up, take it off of anything that I think is promoting inflammation in the body. So if the dog is on a diet that I think could be pro-inflammatory, I need to take that stimulus away before I start adding on drugs and Band-Aids to cover the symptoms.
But that's just so brilliant. I mean, I love that. And the problem is that most of our medicine isn't like that, neither for our pets or for us. The entire focus is the suppression of symptoms, and I think we the people are waking up to the fact that that is just not cutting the mustard anymore.
Absolutely not. And, when I do simple strategies, the stuff we do in my clinic is not always very complicated. It could be as simple as go from ad libitum feeding your dog, where you put out a bowl of kibble in the morning and fill it back up every time it's worn down, to, you know what, look, you have a busy lifestyle, stick with the kibble. Let's choose a better quality kibble. Let's choose something that makes more sense for your dog, and let's feed it the right amount. And let's do it in the morning and in the evening so that your dog learns portion control, loses weight, and feels better from his arthritis. So that's just one way to approach it. Of course, I combine the nutrition side of it with exercise. They need to get exercise, and the acupuncture. And I think acupuncture is amazing. Before I did acupuncture on pets, when I was in school, people would tell me of the amazing things and the amazing results that we could achieve with acupuncture. I would never have believed it. I was a Cornell grad. I looked at them and said, prove it. Now I treat acupuncture patients with acupuncture, and I'm amazed at the results that I get because it brings down the inflammation in the body. It promotes circulation locally. It helps to produce a natural pain relief instead of pumping the dog full of opiates and NSAIDs.
We're here with Dr. Nina Malik, who is a Cornell University-trained veterinarian and with a special interest in integrative veterinary medicine and acupuncture. Our topic is Canary in My Coal Mine, what your pet can teach you about chronic disease and mortality. You can find more information about Dr. Malik through her website, which is liveterinaryacupuncture.com. That's veterinaryacupuncture.com. She also works at New York Vet Specialists in Farmingdale. And we're talking about your pets, yes, and but more importantly, we're talking about how our lifestyle and that of our pets is undermining our health, longevity, and potential for optimal health and well-being. And that's what Dr. Malik is seeing on a daily basis, that our pets are dealing with the same diseases, the same problems, the same obesity epidemic that we human beings are dealing with as well. And that's what we're talking about here. So obesity is a number one concern for our pets and for us. And the nutritional aspect is important. Now, can you break down the nutrition and what is it that our pets are getting that they're not supposed to be getting, and what they should be getting which they're not?
Okay, I mean, nutrition is a very big topic again, and if anyone has questions, they need to talk to their veterinarian specifically about their situation. But the first thing that becomes a problem is treats. Okay, the treats that we can get in the grocery store for our pets are filled with carbohydrates, and they're filled with fat, and they're like little crack treats. Okay, give them to your dog, the glucose spikes up, the insulin spikes up after, the glucose crashes, they're hungry again. A cat with 1 extra pound on it is like a man with 15 extra pounds on it. So, 3 pounds, people say, 3 pounds, no big deal. Well, no, it's a big deal. It's 45 pounds on you. So if you feed a 10-pound dog a small bone treat, that's like a person eating 2 donuts that day. And when, Alex, do we stop with 1 bone treat? Because people equate love with food. And that's part of the problem here. It's very funny because sometimes I try to get a client to cut down on their treating, their snacking with the dog. And they'll say, oh, Dr. Malik, I can't. He just loves it. There's nothing else he'll love more. And I said, well, this is the same dog that we can't even say the word W-A-L-K in the same room with. Because we say the word walk or ride and the dog goes ballistic. So use that as your replacement for the treat. The dog is getting a bigger reward because it likes to go for a walk and it likes to go for a ride than it's getting out of the treat. So it's making that mental shift that there are many other ways to reward a pet and to reward ourselves besides making that emotional attachment to food. That's part of the issue here. The ancestral diet of the dog and cat looks nothing like what's coming out of our bag of food that we're pouring into the dish. Now, who's to say the ancestral diet is the superior diet? Well, we want to get closer to it at least. If you look at ancestral diets of dogs and cats, it would have a much higher percentage of meat, organ, and bone in it. Anywhere between 80-90% even for cats. And cats are probably eating only like a little bit of carbohydrates, 5-7%. The processed kibble that's on the market generally is close to 50% in carbohydrates. So it's a huge excess of carbohydrates for our pets. Now, they make it in such a way, they process it in such a way that it's very digestible. So people argue about that. Oh, it's not digestible. That's not true. It is digestible for the animals the way that they treat it. Okay, but they don't require that amount of carbohydrate. What they require is glucose for their brain cells and their red cells. And they can get that in a bunch of different ways. Now, there are a lot of options about how you can feed your pet. I mean, you can do the processed kibble, the processed wet, which is canned food. Frozen is out there. There's dehydrated that you can rehydrate. There's raw food. There's home-cooked diets. The one caveat I want to say, because I don't want to leave people with the wrong impression on the radio, is that I think the worst diet that you can feed your pet is a diet of, I had chicken last night. Let me get that chicken out of the fridge with my rice, throw together my scraps. Here you go, Scruffy. Because that's not nutritionally balanced for a dog or a cat.
Well, we're here with Dr. Nina Malik, and in a few minutes that we have left, our topic is Canary in My Coal Mine, what your pet can teach you about chronic disease and mortality. You can find Dr. Malik at her website, which is veterinaryacupuncture.com. She works at the New York Vet Specialists here on Long Island in Farmingdale, and I think she's one of the more passionate people in the whole field, and she focuses on integrative veterinary medicine, which I don't think there are many doctors in the human health who are integrative. I would imagine in the world of pets there are probably like none.